All right. Hello, everyone, and thank you for joining us for this webinar titled Empowering Rural Health Leaders, Rural-Specific Trainings and Programs to Boost Your Growth. My name is Cassidy Avila, and I'm the Program Coordinator for the Texas A&M Health Rural Engagement Program. And before we begin, I want to let you know that we are recording. We will share a copy of the recording as well as a copy of the slides in a follow-up email from the Rural Engagement Program. So you'll have those. And we'd love to hear your questions and comments. So please share them in the chat as they come up, and we'll make sure to address them at the right time during the webinar. Additionally, we'll set aside time for Q&A at the end. So now it is my great privilege to introduce our speakers today. I'm going to start with Dr. Bill Auxier. He is President and CEO of Auxier Group and Program Director for the NRHA's Rural Hospital Certification Programs. Dr. Auxier is an expert in rural health leadership development. He's worked with rural health leaders across the country to improve their organizations through more effective leadership, cultural transformation, and strategic plan development. He's the creator and co-host of the Rural Health Leadership Radio podcast and adjunct associate professor at the University of Maryland Global Campus. And now I'll introduce Sydney Grant, who is the Director of Programming and Operations for the Center for Rural Health Leadership, responsible for NRHA's rural hospital certification programs for CEOs, CNOs, CFOs, CMOs, HR directors, board trustees, and rural health nurses. She's also Chief Operations Officer for Auxier Group, which offers coaching, cultural transformation, and other rural health professional development opportunities. She received a Bachelor of Science from Florida State University and a Master of Healthcare Administration from the University of South Florida. Sydney started her journey in rural healthcare as an intern for Dr. Auxier's Rural Health Leadership Radio podcast in 2019 and became co-host in 2022. Sydney's goal is to help provide the tools, networks, and rural resources to rural health leaders across the country to help develop strong leadership and bridge the isolation gap of rural healthcare. We are so honored to have both of you here and to learn more about your programs. And thank you so much for your time. It is all yours.
Well, thank you, Cassidy. Thanks for the nice introduction. It's always good to see you. We've had the joy and privilege of getting to know you over the last few years with our quest and your quest to advance leadership with rural health leaders. So yes, as Cassie said, Sydney and I met when she was a graduate student working on her MHA, where we started working together. And holy cow, it's 6 years later. We've been carrying our mission forward of trying to and do everything we can to improve rural health. In 2019, we visited the CDC, and fortuitously, Sydney tried on a hazmat suit, not knowing that a global pandemic would be following months later after she put the hazmat suit on. But, rural health leadership is so important, and Sydney and I don't take this task on lightly of helping rural health leaders become more effective because it is so important. Leadership is the single biggest predictor of rural health success. We've all heard about the rural hospital closures. We've heard about many of the challenges that all rural health organizations face, all rural health communities face. And, sometimes people say, well, I think it's more financial than anything. And it is true. Obviously, you got to keep the lights on by paying the electric bill, but it's decisions around those financial considerations. And that's where leadership comes into play, making those decisions about everything, not just financial, but it does come down to leadership. I mean, there's all kinds of studies that talk about how leadership is essential to an organization's success, whether it's a hospital, a clinic, a community health center, a wellness center, whatever. Leadership truly does make the difference. And again, that's why we've focused so much on it. Whether it's leadership or management, as well as culture. I mean, you've probably heard the expression that culture eats strategy for breakfast. It's so true. So they're all interrelated on making a difference in rural health. So what Cindy and I hope to do today in this webinar, and thank you to the Texas Rural Health Engagement Program for coordinating this webinar. We want to talk to you about 12 different opportunities available to you to enhance rural health leadership, to make that difference. So I want to share with you, and Sydney will share with you some of these opportunities, and we're going to do it more or less in chronological order. So we do have some ongoing opportunities that are kind of available on demand, if you will. So I mean, you could do it later today if you wanted to with some of these. So let's start with the ongoing opportunities for leadership development. I don't think anybody has to guess at what the top challenge of rural health is these days. I would argue that it's recruitment and retention, getting the staff that you need, the professional staff you need. Yes, providers, but also the other professional staff that you need to deliver the care that your rural communities need and deserve. And that's where professional and personal leadership coaching comes into play, because it can help with recruitment, it can help with retention, but there's a ton of research out there that talks about all the various benefits of executive coaching or professional and personal leadership coaching can help with. Yes, it helps improve retention. Yes, it helps improve recruitment, but it can also help reduce burnout. It can increase productivity. It can have a positive impact on patient satisfaction scores, on quality of care. There are so many different benefits of coaching that it is so important to consider. And when I say coaching, I'm talking about using a certified executive coach that helps with professional and personal leadership development with a 45-minute coaching call. Some people do them once a month, some people do them twice a month, sometimes three times a month. It varies depending on what your needs are. But professional and personal leadership coaching can truly make a difference. And it's something that's available as soon as you want to start. So that is an option, but there's different types of coaching. There is group coaching, which is where a group of individuals come together from different organizations, and it's less personalized, but some people like it better. With the group coaching, we meet twice a month for group coaching, and then there's the one-on-one executive coaching or the personal professional development coaching. So both of those are available. Depends on what you're looking for. And as with any of the programs mentioned here, Cindy and I will include our contact information at the end should you have questions or want to explore any of these programs further. So that's the coaching, but also one of my favorite things is to work directly with the leadership team of rural health organizations to provide a cultural transformation. This just happens to be a photograph of a group of a rural hospital, the executive leadership team, and their goal was to foster trusting relationships to impact the culture of their organization. So the cultural transformation of an organization is so important, especially in today's world, but it's always been important in my mind. But if that's something that you're interested in exploring, that's something that's available on an ongoing basis as well. It's usually a longer engagement. Usually 12 months is the norm that we do, but that can be altered and it can be customized. So that's another ongoing leadership development program that Sydney and I are involved in. So next, I'd like to talk about a more set schedule of training and education opportunities. And to do that, I want to first talk about two different programs, the Rural Health Management Academy and the Rural Health Leadership Academy. So we're focused on management and leadership. So the first of these programs that is coming up is that on October 17th at 1 o'clock Eastern Time, 2 o'clock Central Time. I'm sorry, noon Central Time. The next Rural Health Leadership Academy kicks off. And so the Rural Health Leadership Academy is a program that we created for rural health leaders. And I know that that's kind of a general term, but it's for anybody who wants to grow their leadership skills. And that's all we focus on is leadership. There's 4 modules that we cover in the program, and it's a combination of self-learning as well as group learning. And the whole idea is to get a better understanding of what leadership really is and how you would define leadership. So the whole program is based on the dynamic rural health leadership model, and it starts with the concept of intrapersonal leadership, which is the leadership of self. If you can't lead yourself, how in the world are you going to lead anybody else? And that is the foundation of everything we talk about in this program. Next is the concept of interpersonal leadership, the leadership of others, where we talk about having difficult conversations, that sort of thing, but understanding motivation, understanding power. And then we move on up to organizational leadership, which is leadership of the organization, as you might guess. Here we talk about change initiatives, culture, as well as making difficult decisions. And then we go to community leadership. No organization lives in a vacuum. So you have the community to deal with, the community, the culture of the community to understand, and the impact that you can make as a leader on the community. Hence, the 4 modules are from the dynamic rural health leadership model. And we spend 2 weeks on each of these topics, each of these modules, and that's what makes up the program. So again, the Rural Health Leadership Academy, our next cohort kicks off on October 17th at 1 o'clock Eastern Time, noon Central Time. The next program that's coming up on October 29th is the Rural Health Management Academy. And that kicks off at 1 o'clock Eastern Time or noon Central Time. And the Rural Health Management Academy is really designed for first-time managers, but not only first-time managers, but also maybe managers that have never had any formal training. This program is made up of 10 modules, and it's all self-learning. The learning objectives are listed here of what we want to cover, that we do cover in the Rural Health Management Academy. As you can see, quite a few different things: making difficult decisions, delegating, how to influence organizational culture, and more. The modules that are included in the Rural Health Management Academy are defining management, setting expectations, communicating with clarity, listening, trust, goal setting, difficult conversations, decision making, delegation, and building a culture of connection. And in the next cohort, we're also going to include a couple of bonus modules, one for first-time manager challenges, as well as the power of non-verbal communication. So again, these are all self-learning, it's self-guided, but we do have a kickoff Zoom call and then a celebratory Zoom call at the end. You do need to pass a quiz after each module to move on to the next module to reinforce that learning process. But it's a great program, especially for first-time managers. And again, the Rural Health Management Academy kicks off on October 29th at noon Central Time. So these programs, all the programs that I've shared with you so far, some of them are ongoing: the coaching, the cultural transformation, that's ongoing. The Rural Health Leadership Academy, the Rural Health Management Academy are set classes, if you will, that are done remotely. Sydney and I created the content for all these programs based on our surveys and feedback of focus groups of rural health leaders. So it's all very pragmatic because it comes from people doing the work. So that is some of the upcoming programs, but wait, there's more, and I'll turn it over to Sydney, who, as Cassidy said, Sydney is the director of programming for the NRHA certification programs. So, Sydney, let's talk about the upcoming programs through the NRHA.
All right, thank you, Bill. Yes, so like Bill mentioned, we have a few more programs that we want to join through or talk through, pardon me. So there's about 7 programs here. Our CEO program, our CNO, Chief Nursing Officers, Chief Financial Officers. We've got a program for Chief Medical Officers, Physician Leaders. We have an HR Executive program, a program for Rural Hospital Board members, as well as a Rural Health Nurse certification, a little different from our Chief Nursing Officer program. The Rural Health Nurse program is really focusing on any nurse that's working in rural healthcare. So to kick things off, the upcoming CEO cohort is kicking off on October 21st. So that is our next CEO cohort that is coming up is October 21st. And so we'll dive into that program just a little bit more. So like Bill was mentioning about, the creation of certain programs where we got the content and those sorts of things. All of these programs that we're going to work through in this next section, these certification programs, they were all created by rural hospital executives. So for example, our CEO certification program was created by rural hospital CEOs. So it's truly created by people who have lived or are currently living the experience. And we asked them a simple question of, what do you know now that you wish you would have known then when you first started that position? We do that for each program. And so as you might imagine, there's a lot of interesting information we got from that. But just to give you an idea of, how were these programs made? What is it actually like? They were created by people who have lived the experience. So with our CEO program, we actually just graduated our 8th cohort on last Monday, which is hard to believe. But we've had just about 166-ish participants graduate from our CEO certification program. And so, like I mentioned, we created this program with rural hospital CEOs. This is the curriculum that we came up with. And so again, we asked them that simple but very powerful question of, what do you know now that you wish you would have known then? And so we went back and forth with this group, what we call our advisory board. We went back and forth with that advisory board quite a few times to really, boil things down, get down to what our participants really need to know. And that's how we came up with these 18 modules. So in our CEO program, we do have 18 modules. We spend 2 weeks on each module. We do a little bit of self-guided and group learning in this program. You'll spend time watching some video lessons that our module preceptors or subject matter experts, whatever you'd like to call them, they'll create and record video lessons for our participants to watch. They take no more than 60 minutes of your time to work through. And then we come together as a cohort on a bi-weekly basis for a 90-minute Zoom call where we dive into that topic a little bit more. It's all discussion. So we have small group discussions, we have large group discussions, we make time for Q&A. We always have that preceptor on the call as well. So they'll participate and answer your questions, provide expertise, all of that good stuff. So that's generally how the program runs, but this is just a quick snapshot of our curriculum here that the participants work through. So what's the impact been? So with our CEO program, as well as all of our programs, we do a self-assessed pre and post assessment. And so we're really just trying to gauge, how do participants feel they've grown over the course of this program, which our CEO program is just about 9 months long, start to finish. So over those 9 months, how have you grown? So we take those pre and post assessments and gauge, percent growth for our cohorts. And so across all of our cohorts here, this is the growth that we've seen. So a 24% increase in leadership competencies, 31% increase with operations, huge 39% increase with finance. We see that as a trend in a lot of our programs, that financial modules really have a huge growth within them. We also see a 25% increase in clinical/quality competencies. And then we also like to gauge confidence. We want to know, how much has your confidence grown as a CEO, a CNO, a CFO? You get the idea. We like to see how much that's really grown over time. And so we've seen about a 34% increase in confidence as a leader across all of our cohorts. And so it's a pretty astonishing amount of growth that we've seen. And I think all of these competencies, put together with a boost in confidence is a really strong formula for success and taking it to the next level, so to speak. So that is our CEO certification program. And again, the next kickoff is October 21st. So coming up here soon. And we'll be kicking things off 4 p.m. Eastern time. We have 90-minute Zoom calls, but October 21st is our next CEO cohort kickoff. So next here, October 23rd is for our CNO, our Chief Nursing Officer program. So October 23rd is our fall 2024 cohort, if you're interested. So we'll dive into this program next. So again, a program that was created by rural hospital CNOs for rural hospital CNOs. We've graduated 6 cohorts from our CNO certification program. So just about 138 participants are NRHA CNO certified. And so I'm sure you're asking again, what's the curriculum look like? And again, created by rural hospital CNOs. So a few less modules in this than our CEO program. We have 12 modules in our CNO certification program. And again, we spend 2 weeks on each module. So just about 6 months start to finish with this program to give you an idea of the timeline, but different number of modules in each building block. We go through each with that preceptor, dive into a lot of good conversation and really focus with that CNO lens in rural hospitals. So a quick snapshot of our curriculum there. And some more growth. You can see some pretty awesome growth here too. So about a 36% increase, and this is again across all of our graduated CNO cohorts. So about a 36% increase in leadership competencies, a 46% increase in operational competencies, a whopping 64% in finance. That is huge. We knew how important it was to really create a robust financial building block. That's what our CNO advisory board told us, was that this was a very important building block to work on. And so we love to see that 64% increase in financial competencies there. We know clinical quality is really our CNO's bread and butter. So we didn't expect quite a 64% increase in competencies there, but a solid 25% increase is still quite impressive. And then we like to gauge that confidence as well. So a 39% increase in confidence as a rural hospital CNO. So again, some pretty powerful numbers there. And our next kickoff is October 23rd, 4 p.m. Eastern time. So mark your calendars if you're wanting to join our rural hospital CNO certification program. So upcoming in 2025, we have a few different programs that will be kicking off. So up here first is our CFO, our Chief Financial Officer certification program. We'll dive on into that one next. We've had 3 cohorts complete the CFO certification program. We'll have our 4th cohort graduating at the end of this year. So 73 participants have graduated and are rural hospital CFO certified. And again, some powerful numbers that we've gathered across all of our cohorts with that pre and post assessment. So a 37% increase in the leadership competencies, 35% increase in operations. That 41% increase in finance is our biggest growth there. We were kind of surprised, but at the same time, not totally shocked that there was the most growth in the financial building block with our CFOs, but a pretty powerful number to see there, that 41% increase. We also see a 35% increase in that clinical quality realm. And then again, a 35% increase in confidence as a CFO. So again, a pretty powerful collection of numbers there. And we are planning to kick off the next cohort, I believe in March of 2025. We haven't nailed down an exact date just yet, but we do 1 cohort per year with our CFO certification program. Up next is our CMO certification program. So this is for our Chief Medical Officers. This is a pretty new program. We've only had 1 cohort graduate. We had quite a diverse group of CMOs join from all across the country. It's that way with all of our programs. We always get a nice diverse group of folks from all over the country that come together. But with our CMO certification program, we did the same exact thing. We wanted to gauge, what has the growth been with our very first cohort. So here you can see again some awesome numbers. It is only one cohort, so of course it's going to look a little different than our programs that have had 6, 7, 8 cohorts in them. But still, really powerful to see that 29% increase with leadership, 62% increase in operations. 32% increase in clinical. Again, these are our chief medical officers, so we knew it wasn't going to be quite as impactful as, our financial or operations here, but still, we saw a 32% increase there. A huge 73% increase in those financial competencies. Again, super powerful number. And then a 41% increase in confidence overall. So again, a nice boost in that confidence for our CMOs that have gone through this program. Next up, we have our HR certification program. And so again, this is a cohort that'll be kicking off next year. We do one cohort per year right now with our HR program. We've had 40 participants go through this certification program. And so again, I'm sure you're probably asking yourself, what has the impact been with our HR leaders? They have one less building block in their curriculum than the rest of our programs do. So that's why when you look at this, you might think, something missing there. They just have a different curriculum than our other programs. But again, a 23% increase in the leadership competencies. We saw a 27% increase for both financial and operations, and then a solid 29% increase in confidence, that boost in confidence after completing the program. So again, we do one HR cohort per year, and we'll be kicking off this next one in 2025. Our second to last program here is our Rural Hospital Board Certification Program. And again, we've had one cohort graduate from our board certification program. Again, a program that was created by rural hospital board members from all across the country who got together to create this program. So we've had 16 participants graduate. This program's a little different than our other programs. We didn't group together the modules into building blocks. So on this next slide, when you see the growth, it looks a bit different here. I won't run through all these numbers individually, but we'll make sure we give you a few extra seconds so you can stop and look through these modules with growth. We saw the most growth over here in the board's role in philanthropy, as well as board self-evaluation. Board benchmarking had some really solid growth in there. There's excellent growth in all of these modules. Obviously the ones with the 88%, 83% are huge, but we saw excellent growth across all of these modules with our board certification program, and as well a 50% increase in confidence as a rural hospital board member. That is the highest confidence growth we've seen so far, which again, it's just one cohort, but still it's so powerful to see, what a boost in confidence they get going through this program. So those are some of the results we've seen from our board program. And again, we'll be kicking off another board cohort in 2025. Our last program here that we'll run through is our Rural Health Nurse Certification Program. I touched on this one just briefly when we kicked off this part of the presentation. This program's different from our CNO program in that this one is meant for any and all rural health nurses. So whether you work in a hospital or a clinic or an FQHC or academia even, if you are a rural health nurse, this program is for you. We've had 2 cohorts complete this program. We just kicked off our 3rd cohort about a week ago. So we've had 66 participants graduate from our Rural Health Nurse Certification Program. And again, we did the same thing. We did a pre and post assessment to see what the growth has been for these graduates. So again, slightly different, looks kind of like our board program in the sense that there's no building blocks. We just run through modules with these cohorts, but excellent growth across the board here. Financial overview had a huge amount of growth. That was not surprising for us with 56% increase in competency there. Also, health trends in rural America had a huge boost in growth as well as far as those competencies go. And then we also, of course, gauged confidence, and we've seen about a 31% increase in confidence as a rural health nurse with our graduates. So again, some excellent numbers to look at as far as what the growth has been with our graduates here. So overall, we've had just about 525 people graduate from our rural certification programs. That number is growing all the time. Our average overall confidence growth across all of these programs and all of these cohorts is about a 38% increase in confidence. That's huge. Could you imagine having a 38% increase in your confidence overall? It'd be pretty powerful, especially with all these other, modules that you'll gain some growth, some skills, some knowledge, maybe just some more confidence boosts within those modules. So some pretty powerful numbers, a pretty diverse, robust group of rural health leaders that are just doing what they can to take it to the next level and make a difference for their rural community. So, Bill, what am I missing? What can you add in here?
No, I think you've done a good job of covering everything, Sydney. And the thing I would say to all of you who are with us here today is that I'm sure you've seen a program that might be of interest to you or might be helpful to you. But I'm also sure that you've probably seen a program that might be helpful to someone else. And so I would just say share this information because it's always fascinating to us to find out how many people don't know about these programs, which is why we're doing this webinar today to create a greater awareness of all these opportunities that are available. Because, I guess I should have said this at the beginning, but, when it used to be when I would go to programs, actually both Sydney and I are former board members of ACHE, the American College of Healthcare Executives. We'd go to conferences, attend workshops, and all that. And it's a lot of great information, but a lot of it wasn't applicable to rural. And I found that in other programs or seminars or whatever training programs, great information, but in rural, we just didn't have the resources, whether it be people or money or both, to do that. So that's one of the reasons why we dove into this head first, because there are a lot of challenges in rural, and you can't just take a program that they use in Dallas or Houston or San Antonio or something like that and apply it to your rural setting. It's different. And that's why we've created these. And we're so delighted that with the impact they're making. And I think it's key to understand that the reason why we're getting this impact is because every program we talked about is a program that was created by people doing the work in rural healthcare and telling us what we need to talk about. It wasn't me, it wasn't Sydney saying, oh, we need to talk about that or we need to talk about this. No, it was people doing the work, rolling up their sleeves and doing the work, telling us what need to be covered. And that makes a huge, huge difference. And, I do want to emphasize that, the reason we do all this is because we want to make sure everybody that lives in rural America is taken care of. That's the most important thing. And leadership can truly make the difference to make that happen. So with that, I do share my contact information as well as Sydney's contact information. And I also, and Sydney and I welcome the opportunity to answer any questions any of you might have.
There is one question in the chat here, Bill, from Justin asking, are we able to join more than one program?
Well, from Sydney and my point of view, the answer would be yes. If you're being sponsored through the Texas Rural Health Engagement Program, you would need to check with them. I don't know the answer from their perspective.
I think that we would limit our support to one program per individual.
Okay.
Not that you couldn't do the rural health nurse certification and then later in your career or later through another opportunity with us, expand that to the CNO certification. But I think primarily to make sure that we are using our resources appropriately, we would limit the registration to one course per individual at this time, and not that we can't support multiple individuals from an organization for enrollment in a variety of courses.
That makes
So
total
if you are seeking support through the Rural Engagement Program, please feel free to contact myself or Cassidy. I'll ask Cassidy to drop her email in the chat. You may have been working through one of your regional coordinators. You may have learned about this opportunity from them. So please feel free to reach out to us. There is an additional request form that we ask you to complete when you're requesting any workforce training or certification support through the Rural Engagement Program. And that helps us with our evaluation metrics. We want to make sure that we are providing resources and that they are bringing, impact. So there will be some follow-up questions around that.
That makes total sense, Melissa. But one of the things that Sydney and I are so honored by is a lot of the people that enroll in our programs have participated in another one of the programs that we are engaged with. And that is, for us, that's the highest compliment that we can be paid about the value of the programs that we offer.
Well, these certifications are a big part of our workforce development and support resources that we provide. We know that, especially in the rural settings, there are not a lot of available resources for professional growth and rural specific development opportunities. So we just see this as part of the bigger picture. It's a great recruitment strategy, good for retention. It's a win-win all the way around. So I would encourage you. We have a significant amount of funding to support these types of initiatives. So if you are interested, please reach out to us. We'd love to work with you. Next step would be, after that initial inquiry, one of our technical assistance coordinators would contact you, have some additional discussion, have you fill out that application form for us. It's pretty short. It's 5 or 6 questions. And then facilitate a meeting with Sydney or Bill to talk about the program specific requirements, because it is a time commitment. I don't want anyone to go into this, especially with the NRHA certifications, thinking I'll just do this on my own whenever I have free time, because it's a fairly structured, stringent program, that comes with the significant support costs. So we just want to make sure that everyone understands the commitment.
Yeah, great point, Melissa. I could share just a little extra information on that. The general structure for pretty much all of our certification programs, I would say the only exception is the Rural Health Nurse program. That one's a little bit different. The rest of our certification programs do follow pretty much the same format in the sense of self-guided and group learning. But like I mentioned, I didn't dive too much into it, but I mentioned we spend 2 weeks on each module in most of those programs. And so basically what that looks like is we create a private website for each cohort. That's where we keep all of the content for all of our participants. So everything's available on demand. So in that sense, you can log on anytime, whether it's 12 in the afternoon or midnight, whatever works for you. But you'd go on and watch these pre-recorded video lessons that our module preceptors create. I mentioned they only take 60 minutes, no more than an hour of your time to work through. So in week 1 of this 2-week per module structure, you'd watch those videos. And then we'd come together on a different day and time of the day, depending on the program that you're in. But it's always on the same day of the week at the same time of day. 90 minutes. We start on time and we end on time, but we just meet on a bi-weekly basis. And that's where we dive into the videos you watched. We get into lots of conversation, discussions, questions, challenges that you're facing. How do we figure it out? Going into some case studies, things like that. So that's pretty much the structure that we follow. To Melissa's point, it does follow a structured format. So week 1, you'll watch those videos. Week 2, you'll come together for that 90-minute Zoom call. So that's the basic structure week to week in most of our programs.
And Sydney, I know you said this, but just a reminder that the Rural Health Management Academy is more of a general kind of entry-level management intro to leadership, correct? Versus the NRHA certification courses are much more of a deep dive into the specific administrative, requirements and competencies that you need to have to lead rural healthcare organizations, correct?
Yeah, absolutely. And I would also say with the NRHA programs, they are rural hospital specific, whereas the management and leadership academies are open to just about any rural health organization.
Yeah, we found those very helpful for our rural clinics, especially for, getting rural health clinic staff kind of in the same mindset, helping them with their culture and helping them to all use similar verbiage and to follow similar scripting and to have the same toolkit of resources for leading the work that they do.
Yeah, absolutely. Being on the same page is very valuable.
Yeah, because the Rural Health Management Academy was initially created for first-time managers. And I know that when we coordinated this program with you one time, Melissa, it was mostly first-time managers, but we had a couple of people that had been in some kind of management role for a long time, but they'd never had any type of formal training. So it was very useful because uh, I'm sure it happens in other industries, but particularly in rural health, somebody does a great job as a lab tech. So, hey, let's promote them to be the lab manager, but they've never had any training to be the lab manager or whatever. And so it's for a different audience, like you say, Melissa, but it's also very helpful, very powerful to those first-time managers in particular.
Yeah, so I would encourage the rural hospital leaders that we have on the call, in addition to thinking about the NRHA certifications, think about your clinic staff, think about other team members that may not have opportunity for a lot of leadership development, and consider that Rural Health Management Academy. So like I said, we have some pretty significant resources available to support the cost of attendance, and we would love to work with you on a workforce retention and development plan.
What other questions do we have?
I just put our websites in the chat just so if anybody wants to take a look, you can.
Excellent. Yeah, we did have a comment in the chat, someone stating they're interested. And so I just dropped the link again for you to fill out that inquiry form that Melissa talked about. So you can request support from us on any of these programs that Bill and Sydney have talked about through that link. I don't see any other questions in the chat right now. I will go ahead. I'm going to launch a poll just before I forget, because that happens sometimes. But we are still here, and we will still take your questions. And we'll just have that kind of running in the background. Let me go back to the chat. Okay.
Thanks to everyone for attending today. If you want to learn more about the Rural Engagement Program and the other resources that we have around financial and operational support for our hospitals and clinics, please feel free to visit our website, drop an inquiry form to us, or reach out via email. I know Cassidy shared her email in the chat box.
Yes. And I don't see anything else. So I think that we will be able to wrap up a bit early. But thank you, Bill, and thank you, Sydney, for an excellent presentation and sharing information on your certification programs. It was a pleasure.
Well, thank you
for having us.
Yeah, thanks for having us.
Absolutely. All
All right.
right. Bye-bye, everyone. Thanks, you.
Thanks, everyone.
Thank you.
Bye.